What's up, everybody? David Kemp, host of Highway to Health podcast, here with my buddy Jeffrey Roche. Jeffrey?
Hi, David. How are you? Jeffrey Roche, host of Holistic Leadership, Future of Work, and Education in Healthcare.
Day 3, HLTH, health, whatever you want to call it, in Vegas. The convention center. Yesterday we talked about value-based care, how that all, the progress that we're making there. Here's what almost all of my conversations today were around. It was around, and I use this term a lot, so it's a little self-promotion, but how healthcare is going to take a village to get where we want to go. When we talk about improvements to access, experience, outcomes. And 3 different times today, we talked about why health, why are you here? What about health is exciting for you to take time out of your day to, out of your job to come to this conference. And it's a great collaboration of all different parts of healthcare. And because it's a younger crowd, more of a startup vibe to it in some areas of the event. Why are you acting like that's provocative? That's not provocative. People are more willing to partner, which I think is a good thing. Jeffrey, why are you acting that way?
I think there's all ages here present.
I wasn't even speaking of age. That's on you. But your thoughts on that, it taking a village and what you've seen here?
Yeah, I mean, it does take a village, and I appreciate that David Kemp is using a phrase that Hillary Clinton used during the 1990s healthcare reform. And so, and the reason I say that is we've been talking about it takes a village to reform healthcare for a very long time. So, it does take a village. But the reality of it is
hold on, I didn't invent this saying.
No, Hillary Clinton.
Are you
did.
implying that I'm trying to take credit for something?
No, I'm intrigued the fact that David Kemp would quote something from Hillary Clinton. But the reason that I find it interesting, right, is to your point. I think it is encouraging that health specifically certainly has brought together payers, providers, startups, and I think to your point, everyone wants to do what's right. What I saw, I would say generally what I heard today in various different sessions was. Certainly, what do we need to do to really make sure primary care is the best that it can be for patients? And I think we've got to remember we've got to have the clinicians. And right now, we're at a time where we've got significant physician burnout. In fact, I was reading an article today that is actually a significant tearjerker. And it's interesting because this issue of burnout, when you talk about taking a village, you can't take a village if you don't have the people. And this story was about a nurse who committed suicide recently, and in her obituary. She specifically cited the reason she committed suicide was her health system.
No way.
It's in the obituary. Check out Rebecca Love's post today. And I think we've got to really pay attention to these things because we're at a time when I know I posted an article today on LinkedIn and I heard back from several healthcare professionals who specifically said, "That's me. I'm burnt out. That's me. I'm tired." And so it does take a village, but we've got to take care of our people if we're going to have that village operating.
I don't understand where we're missing the mark. We are working in the most inspiring, rewarding industry of any. And yet we have a hard time attracting top talent, retaining top talent, and then taking care of the people that are meant to take care of everybody else. It's ironic, it's sad, and you're exactly right. We're nothing without the provider, without the caregiver. And have you ever, first of all, it taking a village, that's small town saying. All right, I come from small town. To prove that, have you ever heard of, so God made a farmer?
Yep.
Somebody should do something like that with, so God made a caregiver, or so God made a doctor, or so God made a nurse, because they're that important to our community, every community. We're all patients. I heard somebody say today that there's 350 million patients in the United States. There's 50 million nurses. Think about that.
Yeah.
With that number shrinking by almost 1 million by 2027. It's not scalable. It's not sustainable. Yeah. And we're going pretty quickly towards a cliff here that we may not recover from.
Yeah. Well, I think we have to be excited and encouraged by the fact, I don't know if you saw, but Health announced earlier an even larger focus in the future on nursing. That's pretty revolutionary. We have not, as somebody, I'm sure like you, go to many healthcare conferences, we normally see just a little bit. A lot about physicians, certainly a lot about the industry, but it's encouraging that health is really recognizing that need. And I know that Dr. Bonnie Clipper had a huge role and I salute Bonnie for her work. She's an Austin girl, so we'll give a little credit. We'll give a little credit to Texas. No, I think you're right. And, I think the other piece of this that's really, really important is I'm also encouraged by all the continued investment and work in mental health. We're at a time where, if you look at our children,
Mm-hmm.
you and I read a presentation earlier, you think about our children. Our children are facing behavioral health issues more than any other time, and yet we don't really have access to care in the way that we really should. And so I'm encouraged to see startups really putting forward amazing, really innovations, but also in many ways solutions. And I think even the KidsX work that's occurring is also really exciting to see, because if we don't address these issues head on, we're just going to continue to have the epidemic that it is, and mental health is truly an epidemic.
It is, and I have 4 young ones, and they're facing things that I didn't have to face until I was a young adult, and my kids are 10, 11, 12, and then a young one that's 3. But they're having to face things and being exposed. Here's the truth: they're being exposed to things that mentally they're just not prepared to deal with, whether it's social media, whatever, and so that's challenging. We need as parents, and they need as kids, the resources to manage that, to deal with it, to work through it. Let me get your opinion on something. We talk about, when we come to these conferences, we always say, do more with what you have or do more with less, and automation and innovation is going to make things easier, allow your workforce to do more, to scale. That's usually the talk track. But you touched on something earlier. I mean, at the end of the day, we need more people. How do we do that? I mean, what in your opinion is the path forward to attracting, retaining, and then treating those caregivers the right way so that we have enough?
Yeah. Well, I think on the attracting piece, right, we have to do a better job of reaching the youth earlier on why healthcare is a special place to serve. If you would go out to any school, which I do pretty regularly, and talk to students, they generally know an idea of what a physician does. They generally have an idea of what a nurse does. They don't know all the other ancillary important critical roles, all the other roles in clinical health, the fact that you could be an administrator from a non-clinical perspective. So we've got to really educate them. Healthcare is a special place to serve, and it has huge opportunity for impact. I would argue it's the best industry to work in and the best industry to serve in, and so we've got to help them do that. So the question is, how do you do that? I think we've got to leverage, tools like AR, because we've really got to bring, we have to help our students understand the science behind healthcare from a STEM perspective, and really help them understand that could be them. The second thing I think is, particularly when we talk about our staff, our current staff, as leaders, we've got to make sure that we're doing everything we can to really have a culture that supports and really amplifies the need for psychological safety. We've got to have a sense of belonging for everybody, and we certainly have to really advance, an environment where people feel that they're valued, appreciated, and that they matter. And it's not easy to do. I think, I look at people like Dr. Jonathan Fisher at Novant Health, who's doing phenomenal work around psychological safety and really has been a leader in addressing burnout. He's been a guest on the Holistic Leadership podcast. And Dr. Fisher is not only a good friend, but a cardiologist and somebody who is really rooted in this work. And one of the things Dr. Fisher and I have talked about is we've got to have champions in all aspects of healthcare for this. And we need to have more leaders that are championing it. I also would just say that our boards, our governing boards, trustees, they need to be champions of this too. This is an epidemic. Mental health is an epidemic, and it affects the workplace, and it affects us at home. And ultimately, leaders have a responsibility to address it. And like I said, I'm encouraged that Health had so many sessions throughout this time on not just mental health, but also the integration of mental health, and we've got to address it. And then the third thing I would just say is we've got to really, from an investment end in our healthcare system, really embrace technology from a vantage point. I mean, mental health is going to take tech solutions. It's also going to take human solutions. We are not going to solve the issue of access to care quickly. We don't have enough psychiatrists. We don't have enough psychologists. We don't even have enough social workers. We don't have enough licensed professional counselors. But we can leverage technology in a positive way. And we've seen that. And there's some amazing startups doing work in this space. And so I would just encourage healthcare leaders to not be so slow. The sales cycle in healthcare is abysmal, frankly. On
the provider side, it's almost 2 years.
Oh,
average deal.
It's sickening, frankly.
And then it's another year to get implemented.
Yep.
So we've got another year to get, adopted.
We've got to innovate.
Yeah. And we have to be more accepting to that innovation. And then we also have to, coming from the sell side, you want to get on a soapbox. I'll get on a soapbox. No, we have to be willing to invest in things that, I'll just say it, don't have a hard ROI. If I were selling mental health solutions to any big organization, not just a provider or a health system, but if I were coming to them with a solution or a partnership idea, I'd have to specifically, demonstrably prove that they were going to get whatever they invested, they were going to get back.
Yep.
And then more. And you can't always do that in dollars and cents. Money's tight. I'm not saying it's not. especially on the provider side. And it's always going to be hard to find the money for it. But you got to place your bets sometimes. And sometimes we're in Vegas, it's risky. But what better place to place a bet than on your people, mm-hmm. especially the people that are taking care of an entire community.
Yeah. Well, I think the best way to view it, to your point, is it's a life and death situation. So if you're
Truly.
a leader and you hear of a solution that has the potential to impact that specific scenario, I think you got to make a decision and roll with your heart. Mm. And I think people regularly hear me say that healthcare, it's all about people. Yet from a leadership perspective, we haven't necessarily seen that practiced. And I think if you're a leader in healthcare, now is the time more than ever to be people-centered and to be heart-centered. Yep. And people need to know that they matter, and they need to know that their physical and their mental health and all aspects of the mind, body, spirit are valued. Yeah. Or we won't have a workforce, and our patients won't have people to take care of them.
It's conferences like this that, and others, not just HLTH, but and others that kind of show you, the light at the end of the tunnel, or the positive side of things, because we are making progress. And I think everything that we took in over the last 3 days, and what we'll continue to discuss throughout the end of today and tomorrow, we're living in the golden age of innovation. Now it takes implementation and adoption of those things to really make an impact. And look, necessity breeds creativity and innovation, and there's no bigger need right now than in the healthcare space, and so we'll do it because we've always done it.
Yep.
Anything else?
Yeah, no, I mean, I would just say, I think people have seen, to your point, you say it takes a village. I say it's really all about community. And when I look at the space here at Health, I see really a lot of aspects of community. I see people who not only are in this work because they care, but also because they're passionate. Mm-hmm. And I think what gives me optimism is organizations like Health, because they're doing it differently. They think differently. They do have a huge focus on the people. And look, I mean, you got a unicorn as a mascot. We're on to bigger and better things. So the only better thing that I think in the future is if David Kemp was in the unicorn mascot.
I mean, Halloween's about 2 weeks away.
Well, I can't wait to see that image.
Jeffrey, thank you.
Thank you, David. Can't wait to see that mascot.